As you can see, and as you may remember, over the early period of 2011, lung cancer screening was in the news everywhere. We were performing lung cancer screenings all day long, every day, seemingly for weeks on end, and we wondered if we were ever going to get back to imaging cancer patients. As you can tell, the numbers started to dwindle later into the year. We realized that marketing was going to be a key effort in keeping the lung cancer screening program going. And once we began to increase our local marketing efforts, we definitely saw a little increase in our lung cancer screening patients. We also noticed that once we stopped marketing, the patient volumes dropped. We continued to market throughout the summer of 2013. And now, as you can pretty much tell by these numbers here, our volumes, although flat, remain fairly consistent, despite the fact that we continue to market. Now, if we take a quick comparison view and look at our calcium score program, which has been around much longer, but if we compare it to the exact same, oops, there must be a glitch in the slide, I'm sorry. If we compare it to the exact same time frame of when we started our lung cancer screening program, which is right here in about June of 2011, to current March of 15, we see that these numbers are very, very high. We are having over 100 to 130 to 140 patients every month come for our calcium score. Our calcium score program is run almost exactly the same as our lung cancer screening program, a $99 self-pay fee, as long as you have a referral from your physician. So why the difference? Why such high volumes for calcium score studies and low volumes for lung cancer screening? We have the same referring physician groups sending the patients our way. We have the same low cost of $99, and we have the same convenient access. Here's some thoughts. There's definitely differences between the patient populations. Smokers in the lung cancer screening population compared to those patients in the calcium score population who may be a little bit more health conscious, trying to take care of things that may be looming in the future. Patients who fear the word cancer. Patients typically find heart disease less scary. The rationale is, well, I can go have a cabbage, stop eating so much McDonald's, and I'll be fine. Lung cancer is much more fearful. Enrollment criteria. There is definite differences in enrollment criteria for lung cancer screening patients than there is for calcium score patients. And we'll talk about those enrollment criteria differences in just a moment. Primary care physician reluctance. We know, as we have heard from many of our colleagues in the communities, that primary care physicians are just too busy to tend to following every little nodule that's going to be found in lung cancer screening exams. Lastly, the lack of a physician driver, and this may be a key difference between our two programs. Our calcium score program had a physician driver who actually went out into the community with the information and literature about calcium scoring and presented it to the primary care physician groups. We have yet to identify a key physician driver for our lung cancer screening program.